Hey, what's up everybody? BDF 44 coming at you with another video. Alright, so I just left therapy. Good day. It felt like we were in there for longer than 30 minutes. But essentially she had a housing opportunity for me. This place called the Azalea. It's more or less of opening up a lottery right now for people. And so she gave me the information for that. And I went over to the area next door to try to use their laptop and had no success. I ended up doing it on my phone anyway, but I was able to apply, and I just called the lady Kelly over at the property and just followed up, just to let her know who I am and all of that. She said the lottery's on the 29th and there's no other steps to take, so I took care of that. The closing for that is on the 13th, and so took care of that today, the 9th. But therapy was good, you know. Of course, we set up our appointment for the 13th of May since she's going to be out from here on out, as we know, so no surprises there. She had put on the paperwork that I had to be there at 11:30, had to be there at 12, so I was waiting around for about 30 minutes, but I came on time for what was given to me. But yeah, man, good day, good session. Didn't really get to touch on a whole lot, but she gave me some paperwork to kind of fill out, to kind of assess certain things that from my childhood, how I felt about certain things, how strongly did you feel about this versus how much was this more of a factor, that kind of thing. And it's like about 30 questions. Try to get to the crux of how I was viewing myself and how I was viewing the world around me when I was a child. So I think that'll be helpful. And I'll see her in a month, man, a whole month from now. Essentially she didn't think that I needed sessions as frequently as maybe myself and my family does. I brought that to her attention. I was telling her, what do I have to do to get more sessions? She was like, well, if anything, I don't think you really need them. I'm like, all right, well, I definitely think differently about that. I need sessions once a week in my opinion, but she doesn't feel that based on what she knows about me. And I'm like, look, we got a lot to learn about me. I present very well, and some of the things I struggle with are longly deep rooted. And I'm not as simple of a human being as maybe what you're used to seeing around here. I didn't say it in those words, but like, it's truth. Like, you ain't gonna be able to assess me properly with the couple sessions that we've had and the couple conversations that we've had. You're not. What I got is something that I ain't never heard of. What I'm dealing with is something I've never seen in anyone else. So you're gonna have to understand that. Like, this has been the problem my whole life. People telling me I'm all right because I present well, communicate well, and all that. I don't get to the crux of nothing. We need to dig in. And we need to be open-minded about that. So that's essentially what I was trying to tell her in my own way. Like, look, don't be another one of these people that's telling me I'm okay. This is how people end up getting in trouble with when it comes to myself. I'm not. Never been okay. If I was okay, I'd be. My life would be stable, and the decisions that would make sense would be made rather than some of the struggles that I have. There's a specific problem here, and we need to get to the bottom of it. So that's kind of where my point of view was with her today. I just wanted her to understand, like, yo, I've been having people tell me all my life ain't nothing wrong with me, and as a result, things have been going left ever since. So let's not be another one of those people, more or less. But yeah, man, headed back, I guess, to Hollywood. I don't know, it's still early, man. It's barely 1 o'clock if that. So just go try to make something of this day, I guess. I really feel like getting in bed and going to sleep, but it's the middle of the day, so I'll try to make something happen. But nevertheless, I hope everybody's having a good day. If everything's going well. Of course, I have content for you as we go forward, but I just want to let everybody know that I went to therapy and I inquired about more frequent sessions. So that's pretty much what my goal was. My name is BDF 44. Thank y'all for watching.